Hi, this is Dr. A with your Intro to U.S. Healthcare lesson, and we're in Chapter 8, looking at careers in the health industry, and we're going to look at nurses, and we are in the 5th edition of the Basics of the U.S. Healthcare System. So let's talk about our nurses. Nurses constitute the largest group of healthcare professionals, and they provide the majority of care to patients. They are the patient's advocate, and there are several different types of nurse that provide different types of patient care. There are also different levels of nursing care based on their education and training, and we're going to look at all of these different levels. So the first, and not the lowest level, but the first licensed level is the licensed practical nurse, LPNs. There are approximately 688,000 LPNs in the United States. They are the largest group of nurses and provide basic nursing care. The education to get an LPN is offered often by community colleges or technical schools. The training takes approximately 12 to 14 months, and that's post-high school. So coming out of high school, usually you can start the training and get training in a little over a year. Some programs might require some prerequisites, and some programs just take you in straight out of high school. Their program always has educational, or what we call didactical theoretical classes, but also supervised clinical practice within that 12 to 14 months. They work primarily in hospitals, in home health agencies, and in nursing homes. They are employed heavily in nursing homes for sure, in home health. The 2021 median salary is approximately $41,000. So not great, but again, it's also just 1 year of training. And I have a lot of friends that are nurses, and there are many that started as an LPN, and then there are a lot of bridges to the higher levels. So you can go from an LPN to an RN. You can go to first, you can transition to a 2-year associate degree and then to a 4-year. So there are pathways to move up if a person wishes to do so. So let's talk then about the RNs, the registered nurses. So a registered nurse is a trained nurse who has been licensed by a state board after passing the National Nursing Examination. In 2020, there were 3.1 million RNs. That's a lot of them. They can be registered in more than one state, and some states have agreements to recognize different licenses. There are different levels of registered nursing based on their education. So you have the associate degree, which is typically a 2-year, sometimes takes a bit longer, but 2.5 year program, or to have the 4-year degree, which is the BSN. The 2020 BSN nurses' median annual salary was $78,000. The BSN is the most rigorous of the nursing programs. These programs are offered by colleges and universities, and they usually take 4 to 5 years to complete. Now, you can enter, go to college and go and study, do your 4 years, do you come out with a BSN? Or you can do, like I just mentioned, you can start with an associate RN and then move up to the bachelor's, or you can start with an LPN, then get an associate RN, and then get a bachelor's. So again, there are multiple paths to get to where you want to go. Then we have some advanced practice nurses. So your advanced practice nurses, or APNs, are also known as mid-level practitioners. They are nurses who have experience and education beyond the requirement of an RN, so usually beyond the bachelor's degree. So they've gotten all the way to the bachelor's, and then they've gone on into a master's degree. They operate between the RN and the MD, which is why they are called mid-level practitioners. And so in a lot of ways, these are going to be equivalent in the amount of education and training to your physician assistant that we talked about in the previous video. So they normally obtain a Master of Science in Nursing, an MSN, with a specialty in the field of practice. So maybe they are specialized in geriatrics or critical care or something like that, or they do family practice. So your nurse practitioners are the largest category of these advanced practice nurses, and a lot of them are family nurse practitioners. They are required to obtain an RN and then a master's degree or even a doctoral degree. So we also have these doctorate of nursing practice, the DNPs. And they may receive a certificate program and complete direct patient care and clinical training. So your nurse practitioners will emphasize health education and promotion as well as disease treatments. This is referred to as care and cure. Nurse practitioner can write prescriptions in all states. And in 2020, there were 220,000 nurse practitioners in the United States with an annual average salary of $121,000. So next we have our certified nurse midwives. So these are RNs who have graduated from a nurse midwifery education program that has been accredited by the American College of Nurse Midwives Division of Accreditation. What do? They deliver babies. So they must be recertified every 8 years, and nurse midwives have been practicing in the United States for nearly 90 years. And you have to think that even going back, a lot of the there was a lot of home deliveries, and so nurse midwives can do home deliveries for babies. The 2020 average annual salary is $105,000. And then related to that, we also have certified midwives. So there are individuals who do not have a nursing degree, but have a related health background, and they must take the midwifery education program, which is accredited by the same organization as our certified nurse midwives. In 2023, the average annual salary for a certified midwife is $96,377, so slightly lower than the nurse midwife, but still really good salary. However, these are only recognized in 10 states. Next, we have our nurse anesthetists, or our CRNAs. They provide anesthesia and related care before, during, and after different types of surgical procedures. They provide pain management and some emergency services. This is also a master's level training, could even be doctoral in some areas. And so they have to have already that bachelor's of science in nursing, so the BSRN. And then I know a lot of these nurse anesthetist program require also so many years of experience working in ER, OR, ICU, or something like that, and then coming in and doing the training as a CRNA. The 2022 average annual salary for a CRNA is $195,000. So again, excellent salary. And then lastly, we have our certified nursing assistants, our CNAs. They are unlicensed. They are patient attendants, and they work under the supervision of physicians and nurses. And they do a lot of the grunt work, a lot of the hard work. So they answer patient call bells, they assist patients with personal hygiene, meaning to clean them up, they help them shower, they change the beds, they order their meals, they may even help them eat. So they assist patients with those activities of daily living, meaning eating, getting dressed, washing, using the bathroom. Most CNAs are employed by nursing care facilities, so they work in nursing homes or assisted living facilities. In 2022, there were 1.4 million CNAs, so that's a lot of CNAs, right? And 2022 annual median salary for a CNA is $31,000. So again, this is a low salary because you can do a CNA program in just a few months, actually just a few weeks. You can do it straight out of high school. There are a lot of nursing students that will work as CNAs while they are in nursing school, waiting to get their, usually their RN and pass their board exams, etc. So, okay, so this wraps it up. It's a little shorter lesson, but it was for all nurses. And then our next and last segment, we are going to look at all the other allied health professionals.